So our job as nephrologists is to find and communicate with the patient so that we can do the dialysis, whichever dialysis modality, safely and efficiently. Doing dialysis at home have its advantages because if a person is functional and they want to do dialysis at night and not go to a center, spend a few hours going back and forth every day, that is a good modality to be considered.
If you're starting home dialysis, what happens is that you're going to be getting training for several days, if not a few weeks, in the dialysis center. So that time you get to meet other members of your care team, including the registered dietitian, the licensed clinical social worker, and your nephrologist. And there everything is set into motion. You kind of learn how to do dialysis, and your questions are answered, and you get clarity on your care plan. For patients who are coming to the in-center dialysis, on your first visit, you go over the paperwork to understand what is going to be done. And then in the next several days, you meet your licensed clinical social worker as well as the registered dietitian. It's important to set aside some time to meet with them because that's when they get to learn about your background and your particular situation so that they can tell you all the resources that are available. Our goal is to just use dialysis as a bridge to get you from where you are now to transplant. And during that time, it's very important to keep your body healthy. And if your body is not healthy, many times lead people to actually be denied for transplant because their body is not healthy enough anymore. Or even if they get transplant, in general, they don't do that well. Because for several years, many chronic conditions, they may have had diabetes, high blood pressure, heart conditions, vascular conditions, high phosphorus, weakening of the bones. They kind of kept going on and have taken a toll. And even after you get a transplant, whatever you had before transplant stays back. So I see that sometimes in our transplant patients is conditions which they had before but were not managed properly, and they have these consequences and sequelae which are unpleasant to say the least.